Welcome, Dr. Shalts. Thank you so much for sitting down and talking with me today and sharing your journey. To folks listening to us at home, it's not a coincidence you and I look so much alike. It is an honor as your daughter to get to sit down and talk about the whole journey of your career today, especially one that I've had the privilege and the luck of getting a front row seat to. So thank you so much. Let's start at the beginning. Tell us about your journey. What got you into the medical field and the medical profession?
My journey in medicine began when I was in the 5th grade. I just read a book. Mm-hmm. None of my relatives or parents have ever been physicians. And just light went on in my head. And I decided to become a doctor, just like that.
Awesome. Was it something about the book? What book was it?
It was a book on surgery, and in the beginning I strongly believed that what is going to save the world is going to be heart transplantation. Yeah. So I went on to read a number of books about it, and then in the Soviet Union, I was born and raised in Moscow. At that time it was a part of the Soviet Union. We had a special place which was called the Palace of the Young Pioneers, where you could come in as early as in the 8th grade and study medicine, and then I studied neurophysiology also. I actually developed a method of heart transplants in frogs that made it to the All-Union exhibit.
Wow.
But then I went on to realize that actually most of the stuff that is important happens right here. So that's how it went on.
Is that what got you shifting your focus into psychiatry when you came to the States and continued practicing medicine, or how did that journey transition?
After I graduated the medical school, I went into the field of general medicine and practiced family medicine, and then practiced homeopathy. And also I had a very strong background in neurophysiology research because I also was involved in doing neurophysiology research. And when I came to the United States, I pretty quickly got a job in a neuroendocrinology lab at Columbia University in New York and worked there for about 4 years. And during that time, I was able to pass all the boards that we need to pass in order to go into the residency training program that all the foreigners have to go through that process. And I realized very quickly that what I was missing as a physician in the Soviet Union was an understanding and knowledge of psychology. So I went into the psychiatric residency program, which had as a part training on a very deep level in brief adaptive psychotherapy. That turned out to be Beth Israel Medical Center in New York. So that's how it all came about. And then I fell in love with psychiatry, and it became another passion of mine.
That's amazing. After such a full career, why not retire?
Yeah, it seems to be like an obvious question, but it has even a more obvious to me answer. And I spoke to a number of doctors my age, and we all have the same sentiment. So, of course, when you are in the psychiatric residency training program, it's very difficult. At least it used to be that you have 24-hour shifts, and then you have to work the next day until the end of the day. Plus, I had small children. My life was very busy. Then in the 2nd year of my residency training, I started moonlighting. That's how we call when you work your main job. And then moonlighting is when you have another job to make extra money.
Yeah.
So of course you are dreaming about early retirement. But then as I grew older and more experienced, I realized that this is something that I need to continue to share more and more with people who I can help better and better to feel better and to probably achieve ultimate happiness and health.
Yeah.
I'm not planning to stop anytime soon for now. Maybe another 20 years, we'll see.
Why not? Keep going. I love it.
Thank you.
For the folks listening to us today, let's talk a little bit about the areas that you specialize in terms of your medical profession. and expertise, I should say?
So I wear a number of hats. My main presentation to people and my main credentials are in the field of psychiatry. I'm a board-certified psychiatrist, and I've been doing it for many, many years,
Yeah.
give or take for about 30 plus years. And I specialize in treatment of anxiety disorders, mood disorders, post-traumatic stress disorder, attention deficit hyperactivity disorder, and I have extensive experience in treatment of people on the autistic spectrum. There are also patients who I cannot help in my current practice setup, although I have extensive experience in these fields. And it's important for folks who are listening to us to understand it on a deep level. So yes, I do have experience in treatment of people with schizophrenia. I do have extensive experience in treating people with substance use disorders. That being said, my practice currently is telemedicine only. I do not admit people to the hospital. I cannot offer patients structured, monitored environment, which means that I'm not equipped at this moment to help neither people with severe psychotic disorders, such as schizophrenia and bipolar 1 disorder with psychotic features. I'm sorry that I'm being so specific, but people who have it need to hear it. And I cannot help people with substance use disorders because it's not just about giving somebody a pill or a pat on the shoulder and giving them a talk.
Yeah.
It requires significantly more structure that I cannot offer at this time.
Yeah. Let's talk a little bit more about your process and how you like to work with patients. What's that experience look like that you feel sets you apart, has really made the impact for you and patients in your career?
I don't know how much it translates in this video interview, but I'm extremely passionate about my job, and I'm very involved with my patients. So the first thing that needs to happen is that my potential patient and myself have to make sure that we are comfortable enough with each other so we can form a strong, productive partnership. That's why I invite everyone who wants to come into my practice to go through a process of a free 15-minute introductory interview that is done online. The main purpose is for them to figure out whether they like me, and for me to figure out whether I can honestly feel that this is going to work for the both of us. That applies not only to adults, but also to children, and I do work with children, mostly utilizing, of course, if their parents so desire, complementary and alternative medicine, functional medicine, and homeopathy. We all need to feel comfortable, because if we won't feel comfortable with each other, it's just not going to work out.
Absolutely. What type of research would you recommend for people to do ahead of meeting with someone like yourself, while at the same time finding that balance of not falling into that, internet rabbit hole with how much information is out there these days?
Yes, there is tons of information. Most of the sources are not very reliable, and you wouldn't be able to tell what source to get into. So one of the reasons that I have books published, 3 out of 4 are published on homeopathy, is because I felt that people need to read something that comes from a person like myself who's done it, who has experience in this field, hands-on experience. So what I say there comes from years and years of working with patients day in and day out. These very, very few videos that are posted on YouTube and are linked on my website also would show you what is quantitative EEG, what is neurobiofeedback, and will allow you to take another glimpse in how I am.
Yeah.
So I would strongly recommend to do that.
Yeah.
And if you decide to read one of my books, just read the most recent one, which is called Super Remedies. Just read the introduction.
Yeah. Perfect. What would you say is the most important thing for someone who's looking to meet with you to know, to be prepared for in terms of how you work with patients or what you feel is necessary coming into an appointment with you?
So what necessary is your desire. I'm talking to my potential patients to get better.
Yeah.
And you need to be motivated and you need to be open-minded. And I invite you to go on a journey together with Captain Shalts,
I like
who
that.
is going to navigate your path
Yeah.
to total health and happiness. Of course, we are going to go on a journey. We are going to go together. But still, I'm the captain.
The most important part. What are you most excited about in terms of looking ahead at your career, looking at, the expansion of the medical field, the different tools that are out there? What's on your radar?
Well, I'm hoping very deep in my heart that functional medicine and neuromodulation, quantitative EEG, neurobiofeedback are going to be mainstreamed at some point because they are extremely effective.
Yeah.
Psychopharmacology has been making also an enormous progress. When it comes to homeopathy, that I also practice, this field has not been appreciated enough in this country, although at the end of the 19th and in the beginning of the 20th century, homeopathy ruled the medical field. And it's a totally different, complicated conversation as to why it basically was forced to the fringes of the medical field, and it became almost non-existent. But in my experience, it works in some cases amazingly.
That's awesome. A question I just like to ask because it's one of my favorites, I would say. What is the most impactful, most memorable career advice that you were ever told?
I appreciate this question very much. So when I was in my psychiatric residency training, as a part of this training, we studied brief adaptive psychotherapy. And I was fortunate enough to receive as my supervisor one of the most experienced, seasoned, older therapists from Park Avenue.
Ooh,
Big time.
big time.
And on the first meeting with him, I told him, doctor, I don't think that I'll make a good psychotherapist. And he said, why do you think so? And I said, well, there are two issues with me. One, I'm very personable, and two, I have an accent. And I even thought about hiring a professional to help me get rid of my Russian accent. And he said, you know what, I think that you just have to be yourself.
Yeah.
Because if you are aware that you are personable, you can use it as a tool that is going to be very helpful with working with your patients. And as far as your accent is concerned, it's kind of cute, and some people like doctors and therapists who have an accent. It could be charming. And besides, can you imagine that you lose your accent and keep making grammar mistakes that you periodically make? People will think you're dumb. So a few ways went by. One day I come to my house, pick up the mail, and it has a postcard with a picture from, traditional Russian paintings. And when I turned it around, it says, Dr. Shalts, be like Pushkin. Pushkin is a very famous Russian poet who was quite a character. So I come to my next supervision and tell him, doctor, what does it mean? And he said, look, we all know that Pushkin always was himself. So be like Pushkin.
I love that.
I love this advice.
I love that. Thank you for sharing that. To wrap us up for our great chat today, what do you have going on? Like, what are the projects? What are the conversations that people should look out for that you're working on? What would you like to share with the audience before we finish up?
So I have two humongous projects. One is that I came to realize this famous motto that if you give a person who is hungry a fish, you'll feed one person, and if you teach people how to fish, you'll feed millions. Yeah. I decided that the time has come for me to share my experience and my thoughts in a significantly broader way, and that's the project I'm working on. And another project that I would like to try to work on would be to convince whoever can make a difference that we need to start reviewing our old ways of treating severely mentally ill.
Yeah.
And develop a significantly better approach. Nothing new needs to be invented. I have to say that in some fields, we just have to take a few steps back and help people to have a better, more fulfilling life in probably more structured, supportive environment.
Yeah. We'll make sure to link any of your websites, videos that you're referencing today in this video so folks can continue the journey and follow along with the conversations. Anything you want to say to the audience before we finish?
Yes. Anything and everything is possible.
Thank you so much for sitting down. This was amazing. Thank you again for all your work and for everything you continue to do to allow us to live our best lives as people. So thank you again.
Thank you.